Hi guys, good afternoon. Ben Kaplan here, CEO of Ehave. We're a publicly traded company on the OTC markets, symbols EHVVF. And I'd like to present today a little slideshow I put together for this conference. Uh, Today we're traded around 20 cents a share. We are located in Ontario, Canada. And we've started out around 7 years ago working with digital therapeutics for mental health for ADHD. And we've been partnering up with the Sick Kids Hospital in Toronto. Mental health is a huge problem globally, and we're trying to approach it on a technical and aspect of taking technology and psychedelics and working with our cognitive skill sets to help out humans that have these issues that start at birth, and hopefully we can help them before death. In America, we have almost 1.5 million people that are using telemedicine platforms today for psychedelic treatments. You have patients that are going into clinics. They're looking to help themselves and try to get off of medications that are really intended for the past. In the last 30 years, we've not really put much attention into psychedelic treatments or mental health. And I think in the last few years and going forward, we're going to see that as the forefront, just like oncology was back for the last 30 years. There's a lot of barriers to this. First, we're looking at financial. A lot of people here in the US are not on health insurance. There's a lack of professionals, and there's a lot of social stigma around digital therapeutics and psychedelics. So we're trying to break those barriers here at Ehave. The digital platform we've created is working on multiple platforms, on PCs and Macs, all the way to your iPhone and Android. We're looking to be a data collection company using the subsidiaries that we've acquired to put together a opportunity that would be a progressive, understanding mental health, well-being. Excuse me, sorry about that. We're looking at a cross-platform that can take digital therapeutics, which we created, put it in a form of a. I'm just getting a little feedback here. So we have right now developed games that have been tested out on over 200 humans in clinical trials. We're trying to develop a crossover here where we can take some of these tools and apply it in this new frontier. Well-being and wellness at the forefront, and then assessments, and then hopefully therapeutics. In the last few weeks, a company called Acolyte got approved for the first FDA-approved therapeutic, reimbursable by insurance. And they opened a path for us as Ehave has been on this for the last 5 to 7 years, trying to get to a point that it can effectively apply to FDA. And with what's going on today, we feel there's an opportunity to take the negative impact of COVID and the positive of telemedicine and apply that into a new dimension. We feel that telemedicine is here to stay, and it's going to grow in many different aspects, and one of them will be mental health. Ehave has an acquisition of MD Link. MD Link's one of the largest telemedicine platforms in the Caribbean. They have over 10,000 users. You can download it on the Android or Apple Store. Today, we're looking at Jamaica and the psychedelic world as being ground zero. And with this platform, we have a reach to go out and gather new customers throughout the Caribbean and bring them over to our platform to work with them on day-to-day issues, but more importantly, on the mental health that's hitting not only the Caribbean, but most of the world because of COVID. So what we're looking to be able to achieve is try to put a bridge together to where we can take a telemedicine platform specializing in mental health and then drilling down into psychedelics, utilizing the island as a platform to work out of. Oh, Speak AI technology, a good partner of ours, Tyler. He's out of Toronto. He's created a really nice technology that interfaces with our dashboard. And today, as telemedicine and psychedelic medicine are looking at going online, a lot of this will work where there's emotions in your face, eye contact, a different amount of voice interaction that will help the doctors and research clinicians understand what is going on with the patient. And so someone who can't go into an office or that doesn't want to go into the office as just as little as 6 months ago can now utilize a telemedicine application with some different Bluetooth enabled gear to give the doctor a perspective where he can take qualified notes, which is very important, especially in psychiatric care, and then apply that into an interface. And that's where our dashboard comes in. And it takes them into a place where they can use it like an EMR system and take all the personal health records and then analyze what they're doing with the patient at that time in a digital manner. So right now with Speak AI technology, we think about this as the old dictaphone of the 50s and 60s, but the new interface for 2020 and beyond. We formed a partnership with Burst IQ. They're based out of Denver, Colorado. They're a mental health service company that uses blockchain technology, and we use them for our HIPAA compliant storage. They're an integral part of our dashboard as well. They give us a tool set that helps clinicians, doctors, professors utilize it to collect data in their research. And one of the things that we found out as we go through this process, a lot of technology today has not been applied to this sector where it sits right now in pharmaceuticals or in universities. And so what we're looking to do is offer out a digital system to some of the smaller companies that might not be able to afford some of the larger platforms that are provided by the large drug companies on this research and fill a void. And so Burst IQ is a great partner of ours. They're providing us researchers and doctors, clinicians to help out testing out our dashboard. But more importantly, all this data that gets generated and collected, we now have an opportunity to go up and store it for them in a GDPR and HIPAA compliant situation. So we're very proud of the relationship we've developed with Burst IQ. Digital health records, you're going to hear about that going forward in 2020 and beyond, especially because of COVID. It's very important to have digital health records. And with COVID highlighting this and taking most of the patients that were walking into doctors' offices before into telemedicine platforms, a lot of your medical record needs to be digitalized. So we forged a partnership with MyLifeID. They're a well-established company in Nevada. They've proven to us that they have a gadget that works well and interfaces with many EHR and EMR systems. And it gives the patient the understanding that they can carry their medical records on them, not only in a digital form, but also in an analog form that can be plugged into any emergency room or any computer system at any given time. We see that there's an opportunity here when medical tourism opens back up and you have a bunch of people that are looking to travel to these psychedelic retreats and get an opportunity to fix their issues with their mental position. They have to bring along their medical records, and the doctors and clinicians evaluate, if they're going to take them into these facilities and what type of doses and drugs they might offer somebody depending on their medical history. So My Life ID is a company that we've forged a partnership with a few months ago. We'll be rolling out our Ehave cards in the next 4 to 5 weeks. I know they just came in. And we'll be running a program probably with a Dr. Natan out of Maryland to see how to utilize these with first responders. And I'll get into that a little further on in the deck. Mental health, digital therapeutics. We start off with kids. We started working with Sick Kids, which is a nice sized hospital chain in Toronto. We partnered with a group of doctors and clinician partners that would help us take our games with their cognitive skill sets and apply it for ADD, ADHD, and autism. We have worked on so far 200 plus humans in trials. Our trial has around 140 more to see if it can be validated. And once it's validated, we're going to take it to the FDA and apply for a medical device, just like Acolyte did. And they were the first to get approved with the Endeavor game. You see it in the upper right-hand corner. And this happened a few weeks ago. And they spent over 10 years trying to prove out that digital therapeutics could be just as important as any pharmaceutical drug. So today you can download Ninja Reflexes on the App Store and test out your skill sets. And we feel that in the future, we'll be bringing new games to market utilizing VR and other games that will take some of the skills that we've set for Ninja Reflexes and apply them with new skins and offer them out to consumers as assessment tools. Mental health, the future, psychedelic treatments here in the US are usually ketamine or S-ketamine or intramuscular ketamine. Those are usually provided by psychiatric therapists or MDs. We've partnered with Psych Associates of Maryland. They have over 85,000 patients. They have over 5 offices located in the tri-state area. And we look to work with our partner there, Dr. Natan, in creating a bridge to his patients and our technology to find a void in between some of the pharmaceutical drugs that they offer out today. And so in the future, you'll be hearing about some joint venture partnerships that Ehave's created alongside Psych Associates in trying to take our tool sets and what we've developed at Ehave and apply it to some real life time frame where we can take that data and then offer it out to other psych centers that would like to utilize the same process. So it's very exciting where we're going with psychedelics here in the US. But as JR was just mentioning, there's no real legal psychedelics. So today, ketamine is some of the closest opportunity that these doctors can utilize in a day-to-day process to hail the illnesses that are out there today. Ehave is a technology company. So as you see here, we're going after depression, anxiety, PTSD, opioid addiction. We're going to be using different games that we have partnered up with in different relationships to try to mimic some of the things that MDMA or psilocybin or LSD might offer in a setting. Especially for adolescents, there's really nothing for them except for prescribed drugs. So if we can put together some therapies that fall within inside the guidelines that psychiatrists believe in the science, we'll be able to offer that out at a younger age. And using these digital platforms that we've created, we feel that going forward, this data that we'll be able to collect and compile will be useful in future studies that we're trying to go out and see alongside synthetic drugs, maybe botanical in the future, and see how they combine using technology versus, say, a microdosing of psilocybin for ADHD in adults and the cognitive impressions. So it's really exciting where technology is today and how we're able to cross that over and give therapy in this mental, day and age. Mental health is a huge problem, I think, on a daily basis with this COVID. These psychiatrists are seeing more and more issues that are popping up. And so if we're able to solve just a few of them and be a fraction of the help, it would be a huge success for Ehave. As I mentioned before, our My Life ID partnership is personal health records. We'll be launching our system. This will be a revenue generator for us. We'll be offering out the service around $10 a month. This will include a few gigabytes of storage. And we'll take this process and start offering out a way for consumers to monetize their HIPAA compliant data. So using Burst IQ and their blockchain technology, we're creating smart contracts, and we're going to be giving an opportunity to consumers to use their HIPAA compliant data with a waiver for us to bundle that data load and offer it out to institutions or clinicians that are testing and researching for different ailments in mental health. And we should have one of the larger databases out there in the next few years, compiled by utilizing our MD link, utilizing the data we're collecting with sick kids, and some of the relationships on the Ehave dashboard. Will start giving out the operating system in a partnership to own the data with these organizations. So today, I think PHR is a new terminology, and you'll be hearing more of it going forward, of what someone will be able to do with the personal health records versus today, almost like you see deregulation here in the US in electricity. You might see in the future some deregulation on HIPAA compliant rules and regulations. Today, you can download on the Google Store and App Store MD Link and our Mega Team games. Feel free to download them and utilize the services. They're there for that reason. Ehave, as I mentioned before, will be digital. We're going to go out and offer out our systems to researchers, clinicians, doctors, hospitals, and patients. Once again, to build a very diverse data mine and be able to offer out these data sets in the future to organizations that are going there and universities that might want to start doing studies. We'll partner up with them and offer them the data sets in these partnerships as well. Our Ehave dashboard and personal health record system should be out in Q3, but it's not so far off, and I'll keep everybody updated on where we're at with that, with inside some news releases and our partnerships with SciTech is one of the leading conferences out there. So you'll see some more information about the dashboard and our personal health records coming very shortly. We've made investments in therapeutics and telehealth. Psychedelic investments so far have been 2, and we're starting to do and get involved with clinical trials, as I mentioned, with Dr. Natan and also Maastricht University with King Kopers. We're going to look at microdosing and using our technology with synthetic psilocybin in 20 studied, hopefully in the next 2 quarters. So Q4, we'll be using a synthetic from Cygen in Canada. And we're very excited about these clinical trials and bridging technology as well as the synthetics.
And so I kind of want to break this down a little further. So you've got a telehealth business, you've got the psychedelic side of your business, and I want to understand a little bit more the dichotomy there, right? And the telehealth is a really, really hot market. It seems like, especially during the age of COVID and how we all communicate, how we all feel about our own mental and physical well-being, and how we check in with our doctors. It's all changed, right? So when it comes to where you guys are right now, which are you prioritizing? I'm assuming the telehealth as you're rolling that out, but you tell me.
Oh, well, that's a good question. The telehealth medicine platform, MD Link, is an important part of the ecosystem at Ehave. The reason why we chose to get into telemedicine was to really concentrate on the mental health side and to be able to test out our therapeutics and assessments outside the US, where the rules and regulations of the FDA are very stringent. And so, being one of the largest companies in the Caribbean in mental health will put Ehave in a position that can take and transform our digital technology in a way that we would have had to wait maybe another 3 to 5 years here in the US. So today, as you see some of the future companies that have been trying for the past 10 years, like Acolyte, to get approved, we see that they're now opening up a path for us here in the US that if we are able to have 1,000 or 2,000 case studies on wellness, we can then make an application to them alongside our clinical trials and try to create another digital therapeutic that's reimbursable by insurance. And so today, psychedelics is a broadly used word. Usually it meant taking some type of hallucinogenic and putting yourself in a state of mind. I microdose every other day. I'm on a regimen, and I believe that it's an important thing, especially if you are looking to open up your serotonin and be creative. But today, a lot of people out there are very opposed to or not accustomed to using a psychedelic. And so to offer them something that's digital, which they might be more accustomed to, or a game, which might be much more easier for them to ease into, we're looking at these partnerships to transform this bridge. So telemedicine is just part of the cog in the wheel, and the digital therapeutics is another. And hopefully by 2020, by the end of the year, we'll have a full suite of offerings for this sector.
Very cool. And so that you mentioned Alkali and that ADHD video game, right, that received approval by the FDA. How significant is that?
Well, it's pretty big. Dr. Russell Schechter, who runs the psychiatric division at SickKids, has dedicated his life to digital therapeutics. He's our partner and chief medical officer. And, when they got approved a few weeks ago, it was a relief because we were looking at this path to try to get the FDA to approve something like this as impossible. And now with this COVID out and them streamlining digital therapeutics, we feel that they've paved the way. And so just like any other drug, the first one is the first one, and to be second or third can just be as beneficial for the shareholders and the company. So we're excited.
Very cool. Very cool. And so you mentioned Sick Kids, and I'm assuming that's the same, the hospital for sick children in Canada, or is that different?
Correct. It's in Toronto. I think one of the leaders in Canada for kids and their issues.
Awesome.
Yeah.
And so the clinical trials that you have going with them, can you tell us a little bit more about that? Get a bit more in depth into how those are going, sort of the timeline there.
Sure. Well, I've taken over as CEO a little over a year ago. I was an investor in the company back in 2014 before the IPO, and they came to us with digital therapeutics as a solution. They started off in the hospital with a test of 60 adolescents, and the first results were pretty good to go out and fund the next set of testing, which is 240 adolescents. We were up to a little over 100, and COVID hit, and then the hospital transformed from a children's hospital to a triage. And so everything back in March was put on hold from taking in new participants into the program. But what we're looking for is to see if our games can be therapeutic. And as far as assessing, it's very important. And so today we use skill sets. So when someone plays the game, the timing between their jump or their shooting down a spaceship or going backwards or forwards or kneeling, those work off of algorithms that are then compiled. The Dr. Jennifer Crosby runs the lab, And then she analyzes what a child does with the game, how long they play the game. And then that data is then put together and compiled to see if they're improving their skill sets and if their timing is getting better or worse. And then together, those are some of the requirements for this clinical trial. And once we prove out the model here, we'll take it to the US. We're partners with a company called Pear Therapeutics. We partnered up with them almost 6 years ago. We have a contract that ends in 2024. And they're hopefully, once we're able to prove out the model in Canada, we can then partner up with them and try to make FDA application.
Very cool. And so this is a new space for me in terms of the digital therapeutics and the connection to video games and things of that nature. Do you see any implications, thinking longer out here, in the esports industry, right? You've got a lot of video game companies that are growing rapidly right now, and it's certainly a hot industry, much like a cannabis or a psychedelics. I think we've all seen that. So any sort of crossover or implications that you see there?
Yeah, it's a good question. Esports is a hot topic, especially today when there's no sports really going on.
Oh, don't remind me, man. Come on.
And my son, who's 13, he'd rather sit in front of a screen and participate in some type of interaction, maybe a sporting game or even Minecraft, which is competitive. I think there is a bridge crossover, and hopefully in the future, some of the gaming companies will see what we've created, or even Alkali or some of the other digital therapeutic gaming companies, and entwine some of our data and technology or IP into their gaming decisions. And so to see a cross partnership in the future could be in the headlights. It only makes sense. And as teenagers growing older, that's really where they're going to be looking and utilizing these computer games and esports. So I think today there's a bridge that's being built, but in the future they can drive a tank over it because I think it's going to go hand in hand.
Very cool. Very cool. Well, just in the minute that we have left here, I mean, the common themes that I'm hearing from you right now are technology and data, right? That's how you guys are attacking this. That's perhaps what our investors watching may want to take away. But any last words for them in terms of why Ehave as an opportunity and why now?
Okay, why Ehave? Well, I think that we're a unique opportunity. We're not out developing a molecule. We have a different cost structure for success, and we're looking to partner up with some of the companies like JR's and other psychedelic research companies that could utilize our platform for research and develop a data set that we can then go out and monetize. So I think today we're at the point that if this was 2016 or 2017, we'd be a little ahead of our time. But right now, we're at the peak of the wave. It's exciting.
Very cool. Very cool. Well, Ben Kaplan, thank you so much for joining us today.
Thank you for hosting.
No, it's my pleasure. It's my pleasure. Ehave, EHVVF is again that ticker. And certainly very cool to talk to you and see where you guys are going.
Hopefully, be back in the future. Thanks again, Patrick.
All right, man. Take care.
Bye-bye.